Why do you think the knowledge of kinetics of elimination is so important? What purpose does it serve? What fundamental parameters do we need to study to understand this concept thoroughly? All these questions will be answered in today's episode. And just keep in mind, knowledge and wisdom, they go hand in hand. Like knowledge is knowing that tomato is a fruit, while wisdom is not putting in the fruit salad, right? Welcome all to IS Pharmacology Difficult Podcast. I'm your host, Dr. Radhika Vijay, MBBS MD Pharmacology, and this is the audio hub to get the best simplified basic tips, strategies, methods, and lots of ideas to learn better, understand better, and make your concepts crystal clear. If you really find, and if there's a question hovering in your minds, is pharmacology difficult? Lend me your ears for a while and let in the magic of knowledge. To begin with, there are three fundamental pharmacokinetic parameters to clearly acknowledge the basis of drug elimination. Kinetics. These are bioavailability, denoted by capital F, volume of distribution, denoted by capital V small d, and clearance, denoted by capital CL. For your utter kind information, you can always refer to my episodes about bioavailability and volume of distribution, as these have been a good point of conversation in the past. As already stated, drug elimination is the sum of metabolic inactivation and drug excretion. Today's subhead of the talk is clearly defined as the drug clearance. Yes, it is all about the clearance of the drug. So let's shift our focus towards it. Let me define the whole subject and the concept of clearance with an audio diagram. Just close your eyes. Imagine that the drug of around 20 microgram per ml is entering into the different organs of elimination via the circulation. The different organs of elimination, they can be liver, kidney, etc. Now, after the whole process of elimination, the drug that comes out is less than 20 microgram per ml, and that is coming out into the plasma. Around 1/3 or 1/4 of the drug gets eliminated by the combination effect of the different organs of elimination. The clearance is computed as a ratio of the drug eliminated to the drug entering the system. Now it is the perfect moment to give you the definition of clearance, so you can write it down. It's actually the amount of the plasma from which the drug is removed in unit time. And yes, we have a formula for that. In case you just want to note it down, just write it down randomly as clearance, that is capital CL, is equal to the rate of elimination divided by capital C. And capital C here stands for the concentration of the drug. Now, what do you infer out of this? We can infer out of this explanation that drug is, when given parenterally, especially I'm talking about intravenously, it quickly gets distributed to different body tissues, and you can actually plot the plasma concentration of drug in relation to the time on a graph paper after reviving few repeated blood samples. What will this give you? This plotting of the graph, it will give you the plasma T half, that is the plasma half-life, which is nothing but the time taken for the plasma concentration of drug to decrease by 50% of its value. It actually reflects upon the drug clearance. Now, not related, but a quick general knowledge definition to be noted and learned here at this particular moment is the definition of the biological half-life. What do you mean by saying biological half-life? How is it different from the plasma T-half or the plasma half-life? See, biological half-life means the principal pharmacological drug effect, it decreases by half value. while the plasma half-life is nothing but the time duration taken for the plasma concentration of the drug to decrease by half value. In plasma half-life, the drug concentration is decreasing by half value, while in the biological half-life, the pharmacological drug effect is decreasing by half value. Now I'm going to give you some takeaway learnings about the clearance so you can note them down. The first one is the drug elimination from the plasma. It is quantified in terms of the clearance. I told you that. And this is nothing but it is quite familiar to what you say creatinine clearance. And it refers to the removal of the endogenous creatinine from the plasma. Second important point, you can actually judge the biological fate of drug by knowing the clearance. Yes, you can. Third, now I told you the definition of clearance. Let's quickly revise it. The volume of the plasma from which the drug is completely removed per unit time, that is the clearance. And this amount is eliminated in proportional to the concentration of the drug in the circulation. And that's the formula that I gave you before. Remember, clearance is equal to the rate of elimination divided by capital C, where capital C is the concentration of the drug in the circulation. Now let me put your brains to some exercise, some computational exercises associated with the clearance. Okay, total body clearance is the systemic clearance, and that is denoted by capital CL total. Let's compute it. Now, capital CL total is equal to the clearance from the drug metabolized plus the drug eliminated from the organs. And the major organ of elimination is kidney, while other organs are liver. Now, capital CL total is equal to the capital CL hepatic plus capital CL renal plus capital CL pulmonary plus capital CL other organs. But always remember, principally the capital CL total is equal to the sum of the capital CL hepatic plus the capital CL renal. And difference between the total body clearance and the renal clearance, that gives the value of the hepatic clearance. That is quite clear with this equation. Now, what do you infer from this particular whole equation? That you have to exert a good amount of concern and caution while administering the drugs. First, primarily excreted by the kidney. Second, drugs which have narrow therapeutic index, especially I'm talking about the digoxin. Third, drugs converted active metabolites like benzodiazepines, opioids, antipsychotics, etc. And lastly, to summarize, a few notable points about the clearance are: always remember that the renal clearance, that is eliminated by the filtration by the kidney, that value can never exceed the value of the glomerular filtration rate. And what is the normal value for the male adults? It is 124 ml per minute. And for the female adults, the value is 109, that is 109 ml per minute. If the renal clearance is in excess, say, let's talk about a drug, benzyl penicillin, its renal clearance is around 480 ml per minute. Now that is quite in excess as compared to the normal values, and the drug should be actively secreted by the kidney tubules as a rule. Got it? So these were some of the summarizing important signature remarks. And with this remarkable signature comment, it's the time to put on the ending alphabets in chorus and the time to call it for the day. Hope you found value out of today's convo. Again, remember to keep your knowledge and wisdom hand in hand intact. For all the updates and latest episodes of my podcast, please visit www.ispharmacologydifficult.com, where you can also sign up for a free monthly e-newsletter of mine. It actually contains a lot of updates about medical sciences, drug information updates, and my podcast updates also. You can follow me on different social media handles like Twitter, Insta, Facebook, and LinkedIn. They all are with the same name, is Pharmacology Difficult. If you are listening for the first time, do follow and subscribe whatever platform you are consuming this episode. Stay tuned. Do rate and review on iTunes, Apple Podcast. Stay safe, stay happy, stay enlightened. Thank you!